So today we are going to deal the one more joint, and it's very important joint which is asked commonly. And almost all this is a joint which is explained very big topic because of the presence of the 11 ligaments. So knee joint commonly it is asked for the long question, and ligaments part of this is can be asked for the it is a short notes. Okay, so very important as you have come across the femur study and tibia. So after studying the lower end of femur, upper end of the tibia, it is very easy to understand even patella you have studied. All these three bones taking part in the formation of the knee joint. It is very important you have to remember in the introduction of the knee joint. In this you have to tell the first it is one of the large joint of the lower extremity, and in this you have to explain when you see the lower end of the femur and tibia and patella. So in this is a large joint, but it is a compound we are going to get the complex variety of joint. Complex. Because complexity is due to the presence of the joint cavity. We are going to have the patellofemoral joint and femorotibial joint. So two joints which is we are going to formation in the one total, and more than two bones coming together. That is we are going to call as that is a complex variety of joint. Complex and compound variety of synovial joint. So this is the one which is you have to remember why we are going to call as a complex and compound. So what is the type of joint is asked, that you have to remember. Here in this you have to remember it is one of the large joint of the lower limb, and it is one of the compound variety of synovial joint, and it is a complex joint because the joint is divided by the compartments, and it is involved the bones more than two, lower end of femur, tibia and patella. So that you are going to get this is one of the large joint, synovial, compound and complex variety of joint. Next, going to the as we get the articular surfaces, even you know the type of joint as a synovial, compound and complex variety. When you see in the femur and tibia and patella, you are going to get the joint is as a total one structure. So next you have to remember about this joint is we are going to get actually it is making the flexion and extension usually. Okay, and most important actions which are taking place are the flexion and extension. So that you have to remember it is a component essential, and one of the which is a large joint you are going to get it. Next you have to tell about what are the function I have told. As it is a joint means it has to make the articulation and movement. So that is the one which is you have to remember. Helping for the walking, climbing and weight bearing. Whatever the body weight which is beared by the maximum, not whatever the hip bone is there, that is transmitted to the knee joint. So knee joint to the going to the weight bearing points of the sole. So that it is essentially daily activities essential and weight bearing joint, and it is a main joint responsible for the sports. If you are not fit in the that is a joint which is you get as a knee joint. So this is one of the most important joint is required fitness for the sportsman. Okay, so that they can do these all activity, running, jumping, kicking. So all this is the one you have to remember. Next, articular, I have told the articular surfaces and all. I have told above superiorly, I have told the bones which are taking place lower end of femur, upper end of tibia and patella. Three bones. Then articular surfaces we get the lower end of the femur, means those are the condyles of the femur, medial condyle and lateral condyle. We have lateral condyle and medial condyle. Then we have the tibial, that is a lateral condyle of tibia, medial condyle of the tibia, and patella. So these are the articular surfaces of the, that is a knee joint. Very important, these you have to mention the condyles of the femur, patella, condyles of the tibia. Simple way, don't write. Articular surfaces means femur, tibia, patella. Usually this is made by the students while writing the theory. Articular surfaces, femur, tibia, and patella. No, you have to specifically articular surfaces. You have to write the main thing. The part of the bone which is taking place, that is the taking part in the formation of joint. So that is you have to mention here. And as I have told, the compound and complex, we are going to get the unhinged type of synovial joint. See here how to remember one compound and complex. You are going to get the compound variety as the joint is many bones comes together and joint cavity is divided into a compartments. So that here you have to remember about the compound and complex variety. Hinge variety and condyles, they are making the condylar joint. You are going to get the condylar joints, and we are going, this is very important. Then saddle joint one, which is we are going to get, this is a saddle joint, is especially between the femur and patella. You have come across the type of joints. In that you have got the saddle variety of joint. In the saddle, we are going to get the surfaces are concave convex. Articular surfaces are concave convex. So that this patella is having the, we are going to get the convex and concave part, which is articulates with the concave and convex part of the lower end of the femur. So that is we are going to call as a saddle joint. That is we call as a saddle type of joint, that is a patellofemoral joint. And this all totally we are going to get the hinge variety, compound, complex, and saddle. So 4 words are very important in the joint, that is you have to tell the after that what is the type of the joint. Okay, so type of the joint you have to modified compound, complex, and we have told the hinge. Hinge is one way, whatever we are going to get to open the doors when we open and close. That is a, we have the elbow joint. So that is a, you have to remember hinge. Then saddle joint is between the femur and that is a patella. So 4 words, compound, complex, hinge, and we are going to get the saddle joint. So this is the one which is your term. So I have told the introduction. Introduction of the knee joint is one of the large joint, and it is a complex variety of joint. It is a complexity depends upon the, or it is due to the presence of the joint cavity divided into a compartments. So these compartments which are there, that is one compartment which we can get patellofemoral, then that is the lower end of femur and tibia. So this will be dividing the joint cavity into a different compartments. So that is we are going to get the compound or the complex variety of joint. Then more than 2 bones coming together here. Remaining all is the 2 bones may make the joint, but here 3 bones we are going to get. So that is a depends, that is a complexity of the joint. Then I have told the next what is the type of joint. I have told the modified, complex, and compound, and hinge and saddle joint. I have told what is the example which is a saddle joint. You have to remember. In this you have to have the surfaces of articulation are the concave convex. So next which is you have to remember hinge. I have told elbow, how you have explained the elbow and all that, compound and complex I have told. Then articular surfaces or the articular bones taking part, which is articular surfaces, condyles of femur, you have to tell medial condyle, lateral condyle of femur, medial condyle, lateral condyle of tibia, and patella. So this is all about the articular surface and this. So this joint is very weak joint, even though it is supported by the all 11 ligaments. These all 11 ligaments, even though they are present, even we have the many more than 12 bursas are there. So all supporting structure, even these ligaments are there. So this is, we are not going to call it a strong joint. Many bones are there, complex there, compound joint, hinge variety. Usually hinge type of joints are very strong. But here we are going to get, even this is all you have to remember about the structurally the knee joint is weaker joint. Because why? Because whatever the condyles of the femur are there, they are very hold to shallow condyles of the tibia. Tibial condyles are very shallow, and condyles of femur we are going to get convexity. Means you have to tell the condyles of femur holding the tibia, they are not that much congruent. Congruent means they are perfectly fitting, and depth is increased. There is no depth is increased as we get the glenoidal labrum, acetabular labrum. Due to that, depth of the joint cavity is increased. But here we have the weaker one. Why it is weaker? You have to remember, because the congruent, whatever the condyles of femur, holding the condyles of femur by the tibial condyles, they are very shallow. So that they are not congruent, we call. Because that structurally the joint is very weaker one. Even supported by the many ligaments, 11 ligaments, then also the structurally the knee joint is weaker. Why it is weaker, I have told you. Then all these 11 ligaments are very important. We are going to get the fibrous capsule. Then you have come across the ligamentum patellae, tibial collateral ligament, fibular collateral ligament, popliteal arcuate ligament, oblique popliteal ligament, arcuate popliteal ligament, anterior cruciate ligament, posterior cruciate ligament, medial meniscus, lateral meniscus, and transverse ligament. So these all are the 11 ligaments you have to know, so that we can understand this. So these are the, I have told, fibrous capsule and remaining all medial meniscus, lateral meniscus. Till that you have the 11 ligaments. This is a must you have to know. We are going to discuss one by one. You have to write down, because joint means you have to explain the all 11 ligaments, and half of the marks is for the ligaments explanation. So first we are going to go at fibrous capsule. We are going to get, it is anteriorly absent. When you see the side view of the total knee joint, lower end of the femur, upper end of the tibia, you are going to get. In this you have to explain the all the parts which are anteriorly attached and posteriorly. So concentrate here, only few points I am going to explain how to recollect and how to remember. If you read, you are not going to get it. So in this you have to mention the first one, it is absent anterior. Fibrous capsule is absent because we have the quadriceps femoris muscle. Means all 4 tendons of the muscles of the front of thigh, vastus medialis, lateralis, intermedius, rectus femoris, all they are replacing this capsule anteriorly. So it is very important to remember the fibrous capsule, it is absent anteriorly, replaced by the patella and quadriceps femoris muscle. You are going to get ligamentum patellae. Then what about posteriorly? Posteriorly, it is attached to the femoral side, the condyles and intercondylar fossa, margins of the intercondylar, that is the femoral condyles, means you are going to get the margin. Here the margin of the condyles of the femur, it is attached posteriorly. I am talking about only posteriorly now, because anteriorly it is a deficit or replaced by the quadriceps femoris, patella, ligamentum patellae, fibrous capsule. Then posteriorly it is attached to the margins of the femoral condyles and intercondylar fossa. That is the one you have to do. Inferiorly, except where the popliteus above, you are going to get on the tibial part. When you go to the tibial part, it is attached to the margins of the intercondylar margins of the tibia. So femoral I have told, that is the margins of the femoral condyles attached above. Then below it is attached to the that is the condylar margin of the tibia. Tibia has posteriorly, that is the intercondylar margin. So there it is attached, and here also it is attached about the intercondylar margin, which is we are going to get. So this is superior and inferiorly, posteriorly the attachment of the fibrous capsule. Okay, anteriorly deficit. So this structure you should understand. This is a which is we are going to get the, it is a side view. We are going to get the knee joint. So this is very important to understand what is the fibrous capsule. Okay. Next comes about the ligamentum patellae. So ligamentum patellae, when you see this ligament, the apex of the posterior part of the apex of the patella gives attachment to the upper end of the ligamentum patellae. Here we have the posterior part of the apex of the patella, and it is inserted or attached to the lower part, is attached to the smooth part of the tibial tuberosity, upper smooth part of the tibial tuberosity. So you have to remember here total two attachments you have to remember, above and below. So this is also I have told in the attachment of the tibia and when I have explained the patella. So apex of the patella, posterior surface, that is non-articular because there is attachment of the ligamentum patellae, and inferiorly it is attached to the, you are going to get the, that is a smooth part of the upper part of the tibial tuberosity. So this is one which is, you can see here, patella and ligamentum patellae coming, and upper smooth part which is you are going to get as an attachment of the, that is a ligamentum patellae. 2 points, apex of the patella, posterior surface, and upper smooth area of the upper part of the tibial tuberosity, that is the attachment of the ligamentum patellae. This is explained. It is attached, that is 7.5 centimeter long, 2.5 centimeter broad, that you can explain. So this is the one which is you can second ligament, that is a ligamentum patellae. Then tibial collateral ligament. See name itself, tibia, it is femur to tibia coming. We have the leg bones too, one is tibia and fibula. So medially we are going to get the tibia and laterally fibula. So that we are going to call this as a tibial collateral ligament. It is a flap attached to the medial part of the medial epicondyle of the femur. See here, medial epicondyle of the femur attachment. It is divided into anterior and posterior fibers. So anterior fibers and posterior fibers, they are firmly attached to the medial meniscus, and we are going to get the medial surface of the tibia, tibial shaft. So we are going to get here, we are going to get the medial surface and medial border of the shaft and medial epicondyle of the, that is a femur. So you have to explain the first point. It is one ligament which is supporting the joint medially. As its name itself gives you the medial ligament or the tibial collateral ligament supporting medial side of the joint. It is attached to the femur, medial epicondyle of the that is a femur. Then it is divided into anterior and posterior fiber. We are going to get the tibial collateral, which is attaching to the one which is the medial surface of the tibia, shaft of the tibia. Then another point which is going into the medial meniscus, that is you have to explain. So medial epicondyle of femur to the medial surface and medial border of the shaft of the tibia. That is the attachment you have to remember. Next comes about the fibular collateral ligament. Name again, it is a lateral supporting ligament of the knee joint. In this you are going to get the attachment to the, as we have come across the attachment of the head of the fibula. I have told within the C shape of the attachment of the biceps femoris, we are going to get the C shape attachment on the head of fibula, that is the fibular collateral ligament. So this is the one which is attached to the one that is the lateral epicondyle of the humerus. Fibular collateral ligament, above it is attached to the lateral epicondyle of the femur, Then it is taking attachment below to the head of the fibula, and head of fibula which is embraced by the tendon of the biceps femoris. So that is you have to remember in the here you have the biceps femoris, and we are going to get the fibular collateral ligament attached above, that is a lateral epicondyle of the femur, and below it is attached to the head of the fibula. So I have told the C-shape attachment. Within that C-shape we are going to get the biceps femoris attached. So C-shape attachment on the head of fibula is a fibular collateral ligament. So that is all we have come across in the, that is the study of the muscle attachment of the fibula. So these 2 points you have to remember, and represents the femoral attachment of peroneus longus and all. These are the few points, but main it is attachment is important. Next, going to the next part, oblique popliteal ligament. It is a tendinous expansion of semimembranosus. You have got the muscle which is back of thigh muscle, hamstring. In that we have the semimembranosus. Semimembranosus muscle expansion itself, we are going to get posteriorly, it is supporting, and this expansion of tendinous expansion of semimembranosus, it is forming the oblique popliteal ligament. So this is you have to add strength to the posterior aspect of the capsule, because it is coming posteriorly. Posterior aspect of the capsule is supported by the expansion of semimembranosus muscle, that is you have to tell here. So that is the oblique popliteal ligament. Next comes about the arcuate popliteal ligament. It is a Y shape you are going to get in the popliteal region. We are going to get in the here. You are going to get the Y shape it is. So but it is also we are going to get the tendinous of popliteus muscle. Whatever the tendon of the popliteus which is comes posteriorly, and that part which is making the you are going to get the structure which is you are going to get. So attached to the posterior border of intercondylar area of the tibia. So that is you have to remember, and stem fixed to the styloid process of the head of the fibula. So that is about we call as a shortly arcuate popliteal ligament. Next comes about the cruciate ligament. So you have come across the attachment of the intercondylar area of the tibia, superior surface of the tibia I have told, or intercondylar area of the tibia. So we have the anterior cruciate ligament, posterior cruciate ligament. When you study the patella, recollect, that is a tibia. In the tibia we have come across the superior surface or the intercondylar area. We are going to get the anterior cruciate ligament and posterior cruciate ligament. That is attachment you have come across. So these are the intracapsular ligaments of the knee joint. It is asked in MCQ, name the intracapsular ligaments of the knee joint. So option should be you are going to get anterior cruciate and posterior cruciate. This was once it is asked recently, MCQ. What are the intracapsular ligament of the knee joint? Inside the capsule, almost all forming the on the outer aspect, but this is the one which is inside the capsule we are going to get. Those we call as the intracapsular joint, the intracapsular ligaments which is. So what is this? Anterior cruciate. You are going to get the anteriorly it is attached to the anterior part of the intercondylar area of the tibia. Posterior most smooth part which gives attachment to the posterior cruciate ligament. So that is the one which is you have to make it. And they make the joint very tough during flexion, also during extension. This is one ligament which is makes the joint very tough, because during the movement of the flexion or extension, and this ligament is making main tough. Both the leg make tough, and this is we call it during the flexion and extension. So attachment I have told, it is attached to the anterior part of the intercondylar area of the tibia, anterior cruciate ligament. Then posterior smooth part which is on the intercondylar area of the tibia. that is a posterior cruciate ligament. And these cruciate ligament we are going to call as they are the crossed each other. This is the one ligament which is crossing each other. They are X in the shape of X, attaching from the femur to the tibia and femur to the tibia. They are crossed. Anterior and posterior cruciate, very important. They are crossed each other when you are going to see about the that is anterior and posterior cruciate ligament. So when you see the anterior cruciate ligament attachment, you have come across anterior intercondylary area. Then this direction course will be the upward, backward and laterally it is going. Then you are going to get the posterior part of the medial surface of the lateral condyle, attachment to the femur. Very important, this attachment. And this prevents the posterior displacement of the femur. Because it is anteriorly attached, so not allowing to displace posteriorly. So simple concept you have to apply here. So that is the one which is you have to remember about the anterior cruciate ligament. So that is attachment anterior intercondylary area. Direction of ligament will be upwards, backwards, laterally, and we are going to get on the medial surface of the lateral condyle attachment. Posterior part of the we are going to get the medial surface of the lateral condyle. Condyle you have to remember medial lateral. In that medial lateral surface is via, so that it is attaching from the medial surface of the lateral condyle of the femur. So this is very important, you have to remember, and it is a prevent posterior displacement. Next comes posterior cruciate ligament. I have told posterior condyle, intercondylar area attached, smooth area which is I have told upwards, forwards and medially it is running. Upwards, forwards and medially, and anterior lateral surface of the medial condyle it is attached to the femur. Lateral surface of the medial condyle of the femur it is attached. So this is attachment direction, means it is a crossing. X I have told, which is the anterior to going to the posterior laterally, posterior to the coming forwards and medially it is coming. So this is the direction of the fibers or the ligament. Then function, this will prevent the anterior displacement of the that is the tibia or fibula, that is the tibia or the femur. So displacement anteriorly is prevented by the, we are going to get the posterior cruciate ligament. So this is about the two anterior and posterior cruciate ligament. Then we get the menisci. This is nothing but it is a one which is a fibrocartilaginous thin sheet like we are going to get, which is curved on the upper surface of the tibia, condyles of the tibia on the superior knee. So we are going to get crescentic in C shape. You are going to get C shape on the upper. These are the we have dealt cruciate ligament, anterior, posterior. Now I am dealing the upper or the superior surface of the tibia, condyles of the tibia. We have the menisci. So what is the menisci? We are going to get, these are also intracapsular ligament. Intracapsular ligament you have to remember. And these are the C shape which are we are going to get these will be making the increases the depth of the that is the cavity of the tibial condyles to hold the lower end of the femur. So this concept you have to remember, because tear injury of this commonest one we are going to get. Every people who are comes after the 45 and 50 years of age, they get the pain in the knee joint because of the other many factors associated with that, like weight gain, obesity, other factors like diabetes and all. So that condition we maximum we are going to get, that is an injury to the menisci. Menisci means what? These are the thin fibrocartilaginous sheet it is, which is separating in between the lower end of femur and tibia. So in that this is there. If it is goes means directly bone, lower end of femur directly touching with the upper end of the tibia and causing the restricted movement and severe pain. This will act as a in between the part cushion, and also it is having the synovial fluid which is present in the joint, that will act like a shock absorber. So that these are very important. Whatever the knee replacement and all, I will deal in the applied anatomy. In that, what we do, I will tell. But here you have to remember about the fibular collateral ligament and tendinous popliteus. This you have to remember. These are the small seat-like fibrocartilaginous seat which is separating the lower end of femur to the upper end of the tibia, and they will act like a cushion, and they are in the C shape. We have two, lateral meniscus and medial meniscus. Understand? Lateral meniscus and medial meniscus. It is having the two ends, anterior and posterior. It is having the one which is medial border and lateral border. It is having the superior and inferior surface. Each meniscus is having the two ends, two borders, two surfaces. So I have told here, you can see highlighted. You can go to the highlighted part where you can remember anterior and posterior, medial border, lateral border, superior surface and inferior surface. So what is the menisci? You have to remember. So this is about the medial and lateral meniscus. Then lastly we get the 11th ligament, that is a transverse ligament. Two ends of the menisci anteriorly bridged by the fibrous ligament, that is a transverse ligament. So this is the one which is we get as a transverse ligament, which is bridges or connects the anterior end of cruciate ligament. That is we call as a transverse ligament. So these are the things which is you have to remember about the all ligaments of the, that is a knee joint. So we have dealt the fibrous capsule, ligamentum patellae, tibial collateral ligament, fibular collateral ligament, arcuate popliteal ligament. Then we have got the anterior cruciate, posterior cruciate ligament, medial meniscus, lateral meniscus, transverse ligament, then oblique popliteal ligament. So these all 11 ligaments we have dealt with. So these are the 11 ligaments. You have to at least 5 to 6 lines you have to explain. What is the superiorly to the femur attached and tibia, what is attachment? This is one. In that you have to know the fibrous capsule, ligamentum patellae, tibial collateral ligament, fibular collateral ligament and cruciate ligament. At least out of 11, able to write at least 8 to 9 ligament explanation. Leave about the arcuate popliteal ligament, oblique popliteal ligament. These you left means remaining all tibial collateral, fibular collateral, ligamentum patellae, fibrous capsule and cruciate ligament. They are the very important, which is you should able to write in the joint. So that is understanding the most point. Next comes about this is the coronary ligament, also part in which we are going to get in the fibrous capsule. This, as I have told, the synovial joint we are going to get, it is lined by the fibrous capsule interior synovial membrane. That lining we call as the synovial membrane. And within this we have the synovial fluid is present. We are going to call as the synovial fluid. Functions you know. So that is all about relating about the synovial membrane. Then next comes about this synovial membrane also. Bursas of the knee joint. Bursas are the lubricating mechanism which are provided at the sites of friction to prevent the usual wear and tear. So that time you have the maximum, you are going to get the about 12 bursas. And see, 11 we are going to get ligaments, 12 bursa. This much all are structures supporting, but again we are calling knee joint is a weaker joint. Okay, so that this bursas where you can found in the 4 are to the front of the joint, 2 on either side and 4 behind, making total 12 bursa. So this is just you have to tell knee joint is having the 12 bursa, which you have the front 4 and we are going to get on either side each 2, then we are going to get the behind 4 and making the 12 bursa. So this is one, you have to just tell that this much only bursa, explanation is not required. for the theory. So maximum you have to remember about the this one. So we have anterior bursa and posterior bursa, prepatellar bursas and all I have told in the content of the front of the thigh region. So these we have infrapatellar bursa and infrapatellar deep bursa, prepatellar bursa and suprapatellar bursa. So name itself, they give the location of the bursas. We are going to get suprapatellar above upper part of the patella, prepatellar in front of the patella, superficial infrapatellar below, but we are going to get superficial, and we have the deep. So these we are going to get the bursa around this. So these inflammation I have told, the inflammation of or bursitis we call, that will cause the commonest condition housemaid's knee, clergyman's knee. Housemaid's knee, clergyman's knee we have dealt in the front of thigh, that is the content of the front of thigh. So these are the bursas you have to only name, that is you are going to get. So lateral bursa, I have told laterally 2, medial we have lateral and medial 2, anteriorly 4, posteriorly 4, we are going to get total, we are making this. So these are the bursas we have to remember. But not require the explanation, that is you have to remember about the posterior bursa. So this is the one which is you have to remember about the almost all we have come across the first part of the knee joint. In that we have studied the introduction, articular surfaces, type of joint, then strength of the joint or the stability of the joint I have told. Then I have told the 11 ligament explanation, detailed study of the 11 ligaments. Then what is the bursas which are present in the, that is a knee joint. So able to write only the explanation of the ligament. You should able to write the only number of bursas which are there, that you are to able to mention. But prepatellar, infrapatellar, suprapatellar, superficial, deep patellar, bursa, at least you should have, because that relates to the bursitis, housemaid's knee and clergyman's knee. So this is the one which is you have to remember. So this one which is represented the all the ligaments of the knee joint. So diagrams which is you have to practice is ligaments. Here one which is a ligamentum patellae you have to draw as simple. Patella you know, tibia you have to know. This is a fibrous capsule. If you don't know this also okay, but you should able to draw the diagram of the ligamentum patellae. Then we have this tibial collateral ligament and fibular collateral ligament. And cruciate ligament at least you should know. So this is the one which is you have to know about the ligaments of the knee joint. So these all are the one which is you have to remember. The remaining part, relations and all, I am going to explain in the next lecture. Okay? Write down